How to best check if you have type 2 diabetes. Do you have type 2 diabetes, or are you at risk for diabetes? Do you worry about your blood sugar? Then you've come to the right place. The disease diabetes any type means that you have too much sugar in your blood. This video will show you how to best check this. You can normalize your blood sugar naturally as needed, without pills, calorie counting or hunger. Many people have already done so. As a bonus, a normalized blood sugar usually makes you healthier and leaner. Is your blood sugar normal? Here's a crash course in diabetes and high blood sugar. Symptoms. Common symptoms of diabetes: excessive thirst and an abnormally high urine production. This is because periodically blood sugar is so high, above 15 mmol, L or 270 mg per deciliter, that it leaks out into the urine, pulling fluid from the body, which increases thirst. Blurry vision is also common. All the sugar makes the lens in the eye swell and you will become more nearsighted fatigue. With diabetes type 1, you may inexplicably lose weight and your breath may smell of acetone, nail polish remover. However, please note that with milder forms of diabetes you often don't notice anything. Still, all that sugar in the blood may gradually damage your body. Test. Are you diabetic? If you don't know already, this is simple to test in a few seconds. Either in your doctor's office or with your own cheap blood glucose meter. Prick your finger and a drop of blood is all that's needed. A normal blood sugar level is up to 6 mmol, L 108 mg per deciliter fasting, or up to 8.7 mmol, L 156 mg per deciliter after a meal. A marginally elevated blood sugar level may indicate prediabetes. Above 7.0 mmol, L 126 mg per deciliter fasting, or 12.2 220 after a meal, indicates that you are diabetic. You may also test your urine with urine test strips. Glucose in the urine usually indicates that you are diabetic. Test, and you will know. Type 2. Type 2 diabetes is by far the most common form, around 90% of all cases, and the one which is increasing the most. It primarily affects overweight people in middle age or later. It's not uncommon for the affected person to also have a high blood pressure and an abnormal lipid profile. Gestational diabetes is a temporary special case of type 2 diabetes. In type 2 diabetes, the body has an increasingly harder time to handle all the sugar in the blood. Large amounts of the blood sugar-lowering hormone insulin are produced, but it's still not enough, as insulin sensitivity decreases. At the time of being diagnosed with type 2 diabetes, diabetics usually have 10 times more insulin in their bodies than normal. As a side effect, this insulin stores fat and causes weight gain, something that has often been in progress for many years before the disease was diagnosed. Type 1. Type 1 diabetes. Juvenile onset diabetes primarily affects children and young adults. People who get type 1 diabetes are often of normal weight. In the months prior to being diagnosed, they have usually lost weight inexplicably. Type 1 diabetes is caused by death of most of the body's insulin-producing cells, from an unknown cause. Severe deficiency in insulin causes high blood sugar and rapid weight loss. Treatment primarily consists of administering the insulin you don't make with insulin injections. In addition, a diet that doesn't raise blood sugar dramatically facilitates getting a stable and normal blood sugar. Thanks for watching. And don't forget to like and subscribe. For more information about 7 steps to health and the big diabetes lie, see description below.